Well, good morning. My clock says 11, so we'll go ahead and get started. Welcome and thank you for joining us for today's webinar on vaccines for kids, facts versus fiction. We are happy today to be joined by two experts who I'll introduce in a second. But first, I just want to go over a couple of logistics. The webinar is scheduled for 1 hour. Depending on your questions, we may finish early. The slides will be emailed to everyone who registered tomorrow. And I want to flag two other webinars that TJC is hosting coming up on December 7th. We'll be talking about connecting seniors to food assistance programs. And then on the 16th, we'll talk about the ins and outs of Tennessee's Katie Beckett program. So stay tuned for those things and you'll be able to register for them with the link that I'll share later on. And so first, a little bit about the Tennessee Justice Center before we start with today's topic. For those who aren't familiar with TJC, we do represent individual clients who need help accessing healthcare and nutrition benefits, primarily low-income children and families, people with disabilities, older adults, and other people who qualify for those public assistance programs. We also try to identify systemic issues through our individual client representation and bring high impact litigation to correct those systemic issues to remove barriers for people in our state. And we also advocate for legislative changes both at the state and the federal level on things that impact low-income families, specifically related to healthcare and nutrition. And so with that, I will stop sharing and allow Dee and Barb to get their screens ready to share, and I will just briefly introduce them. So we are really pleased to have Dorothy Sinard and Barbara Dentz, who are both pediatricians. And if you can't tell from looking at them, they are also twin sisters. And they are really active in educating people about immunizations and vaccinations for children. They are both moms, in addition to being pediatricians, and they advocate for child health and safety, including vaccinations. And they're going to discuss how the vaccines work, specifically the COVID-19 vaccine, but also other vaccines and immunizations that help keep kids healthy. They'll talk about why we need these things and ways that you all can be vaccine champions. We do realize that vaccines are under attack, both online as well as in our state legislature. And so we want to help advocates, providers, and parents learn information about vaccines and other routine immunizations so that you will be able to discern facts from fiction and join the fight to really improve public health for everyone. So with that, I will turn it over to Dee and Barb, and thank you so much for being here today.
Thank you so much, Kanika. Can everybody see that?
Yes.
Great. Great. Welcome, everyone. We know many of you, but for those of you who can't tell us apart, I'm Barb Dentz, and this is my twin sister, Dee Sinard. We are both pediatricians by training, as Kanika said, and we work as child health and safety advocates. Dee and I are excited and honored to have this opportunity to share a few thoughts with you today. Here is a roadmap for where we are headed with our talk. First, we will be giving you some good information about the newly approved COVID vaccine for children 5 to 11 years old. Next, we will talk briefly about the infodemic that is occurring at the same time as the COVID pandemic. And finally, we will take you on a drive through the community toolkit for addressing health misinformation, which was recently released by the Office of the Surgeon General. We will also share with you some of our favorite resources along the way. Parents want to know how vaccines work. To get started, we're going to share a brief video published by the American Academy of Pediatrics and their organization for parents, which is called Healthy Children.
Vaccines work like invisible coaches. They partner with your child's immune system, teaching it how to stay strong and healthy when exposed to viruses and other threats. Vaccination is one of the most effective ways to protect your child from preventable diseases and to help them thrive. While some people are just hearing about them now, vaccines made with messenger ribonucleic acid, or mRNA, have been studied for decades. Unlike many childhood vaccines that contain tiny parts of a virus or bacteria to train the immune system, mRNA COVID-19 vaccines don't contain any parts of the coronavirus. Instead, they teach the body to recognize the virus in the future. The mRNA in the vaccine teaches your child's immune system to do what it would normally do, but faster and better. As soon as the vaccine is injected into your child's upper arm, it goes to work. You've probably seen pictures of the coronavirus, a ball covered in spikes. Vaccines using mRNA teach your child's body to make spikes out of proteins. These proteins look like spikes on the virus that causes COVID-19, but aren't actually the virus. Your child's immune system recognizes that the spikes shouldn't be there, so it produces antibodies that eliminate those spike proteins. The antibodies then remember what to do if your child is exposed to the virus in the future. This all happens very quickly. After the mRNA in the vaccine instructs your child's body how to make the spike protein, it's broken down in a matter of hours. A second vaccine dose about 3 to 4 weeks later reinforces the earlier instructions so that the immune system prepares itself even better. 2 weeks after your child gets the second dose, they are considered fully vaccinated. Most vaccinations, including a COVID-19 vaccination, can sting. Some people have a sore arm afterward. Just like adults, some children may experience fever, chills, headache, or nausea. Those side effects go away quickly and are a sign that the immune system is learning how to protect the body against the virus, similar to how your muscles feel sore after a workout. Serious side effects from vaccination are very rare. Of children who do experience side effects, most feel back to normal in a few days. If your child is fully vaccinated, they are far less likely to get infected. Or on the rare chance that they get COVID-19, they're far less likely to become seriously ill or die. COVID-19 vaccination gives peace of mind because it greatly decreases the risk of COVID-19 infection. Like a good coach, the vaccine does its job, and your child will be in good shape, ready to thrive.
To recap, here is some important information regarding mRNA vaccines. Vaccine scientists have been studying mRNA vaccines for decades. mRNA vaccines don't contain any virus or even parts of the virus, so they cannot cause COVID disease. Instead, vaccines teach our bodies to fight the coronavirus if we are exposed to the virus in the future. The vaccines decrease the risk of getting infected with COVID, and the vaccines prevent severe illness and death from COVID in almost all cases. We would like to share a few more facts about vaccine side effects. As you heard in the video, common side effects from this vaccine are the same ones that we have seen in adults: sore arm, fever, chills, headache, nausea. These side effects are generally mild and they go away quickly. Myocarditis, inflammation of the heart, has been found to be a rare side effect associated with getting the COVID-19 mRNA vaccines. When myocarditis occurs with the vaccine, it tends to occur in older adolescent and younger adult males. This vaccine-related myocarditis tends to occur within 4 days after getting the second dose of the vaccine, and it usually resolves completely without any treatment. It is important to know that this vaccine-related myocarditis is rare, and scientists expect it to be even more rare in younger children. Furthermore, COVID disease can cause myocarditis. In fact, the risk of experiencing myocarditis is greater in an unvaccinated person than in a vaccinated person. After millions of vaccinations, there is no evidence that COVID-19 vaccines affect fertility in men or women during their childbearing years. There is absolutely no reason to expect these vaccines will affect fertility in children either. Finally, the components of the vaccine remain in the body for a few weeks at most, and only the protection provided by the vaccine remains. Fears of long-term effects from the vaccines are really unfounded. Let's discuss the reasons why it is important to protect children from COVID-19. We're going to start with another short video that was produced by the Department of Health and Human Services as part of their We Can Do This campaign. Here is pediatrician Dr. Boyd.
So first, it's really important for parents to understand that COVID absolutely affects kids, that kids can get very sick from COVID, kids can be hospitalized because they had COVID, and kids have died from COVID. And so we want to dispel the myth that kids are not affected. Kids are affected. And when I'm talking to Black folks and our Latinx populations, it's important that we understand that our kids were the most affected. When you look at the kids over the last year who got incredibly sick from COVID and had to be hospitalized or had that rare outcome we saw with COVID in kids called MIS-C, which stands for multi-inflammatory syndrome in children, which is a syndrome that basically causes organ failure and places kids at risk for death and other complications. Those syndromes and hospitalization was highest in our communities. So the idea that kids aren't affected isn't true for any child, and it especially isn't true for our communities.
Our next two slides are from the presentation that pediatrician Dr. Jefferson Jones from the CDC COVID-19 Public Health Response Team gave to the ACIP on November 2nd, 2021. This slide summarizes the CDC information on COVID-19 infections in children aged 5 to 11 years old in the US. As you can see, children do get COVID. Thousands of US children 5 to 11 years old have become severely ill, and nearly 100 children in this age range have died. No one, particularly a child, should die from a vaccine preventable disease. In addition, some children have suffered and continue to suffer from effects of long COVID. The most common lingering symptoms being reported by children are tiredness, headache, insomnia, trouble concentrating, muscle and joint pain, and cough. Finally, children can and do transmit the virus to other people. That means they transmit the virus to parents, grandparents, teachers, coaches, and to other children. Based on these facts, and information from the vaccine studies in this age group, the ACIP voted to recommend the COVID-19 mRNA vaccine for children 5 to 11 years old. Dr. Paul Offit and the Children's Hospital of Philadelphia Vaccine Education Center summarized their advice to parents with these words. While it is natural to feel nervous about getting your child vaccinated, it is important to honestly and open-mindedly evaluate the risks and benefits associated with either choice. Only then can you rest assured that you are making the best decision for your child. A choice not to vaccinate a child is not a risk-free choice. It is a decision to make a different, it is a decision to take a different and more serious risk. So I'm sure you've heard this one. What if my child already had COVID? The simple answer to this question is still get them vaccinated. The common side effect from the vaccine actually appeared to be milder if there is prior exposure to the disease. And the vaccine-induced immunity is better and more consistent than immunity from the disease alone. This slide is to remind us, to remind you how important it is to get the flu shot this year. The flu didn't really circulate last year, most likely due to mitigation measures that were in place to slow the spread of COVID. Unfortunately, influenza, the virus that causes the flu, is already circulating this year. Public health officials are strongly encouraging COVID vaccines and boosters and flu vaccines as the best way to keep ourselves and our loved ones safe this winter. Children 6 months and older can receive a flu shot. And for everyone 5 years and older, the COVID vaccine could be administered during the same visit. In our COVID-19 world, people are exposed to information from news, public health guidance, fact sheets, infographics, research, opinions, rumors, myths, falsehoods, and more. The WHO and the UN have characterized this unprecedented spread of information as an infodemic. Amid all this information, health misinformation
Sorry, everyone, for that issue. We can't hear you guys, and your screen froze right as you were saying misinformation. Okay, I can see your screen now. Okay.
Okay.
Yes.
Sorry, we zoned out there for a minute.
No problem.
We're back.
Thank you.
Okay, so I'm going to start back at the beginning of this slide. Earlier this year, so I can try to pronounce his name again, the U.S. Surgeon General, Dr. Vivek Murthy, issued an advisory called Confronting Health Misinformation. The advisory states, a Surgeon General's advisory is a public statement that calls the American people's attention to a public health issue and provides recommendations for how that issue should be addressed. Advisories are reserved for significant public health challenges that need the American people's immediate awareness. Clearly, we have an infodemic, and health misinformation is causing a significant public health challenge. Where do we go from here? Last month, the Office of the U.S. Surgeon General released this community toolkit for addressing health misinformation. They defined misinformation as information that is false, inaccurate, or misleading, according to the best available evidence at the time. We are going to take a quick tour through the community toolkit now. Again, misinformation is information that is false, inaccurate, or misleading according to the best available evidence at the time. We are all susceptible to misinformation, and we're all tempted to share it. Why? Because we are all trying to make sense of current events, to stay safe, and to share information that we think will help those around us to stay safe as well. The toolkit provides these tips for talking to your family, friends, and community. First, second, and third, listen, listen, and listen. The best way to change someone's mind about misinformation is to listen to their fears and try to understand why they believe what they do. Also, show empathy. Emphasize that there are often reasons why people find it difficult to trust certain sources of information. Ask questions to understand where they're coming from. And admit you have struggled with knowing what is true and false. Point to credible sources. underscore that finding accurate information can be hard, especially during events like the pandemic when the information is constantly changing. Emphasize the need to find credible sources who are not in a position to personally profit or to gain power or influence, and remind them that an expert on one topic might not be the best expert to turn to around another topic. Don't publicly shame. Enough said. Finally, use inclusive language. Use phrases like, I understand, I've been confused too. It's so hard to know who to trust. And try to include terms like our community, our families, we and us, so that the person feels that you are identifying with them. The toolkit presents multiple disinformation tactics, and we're going to recommend that you spend some time reading this section of the toolkit and then practice looking for examples of health misinformation that you see or hear. The toolkit also includes this quick checklist that you can use to help determine if information you see or hear is valid or not. 1, check with the CDC, Public Health Department, or other trusted source to see if they have information on the claim that's being made. 2, ask your pediatrician or another credible healthcare provider for additional information. 3, type the claim into a search engine and see if it has been verified by a credible source. 4, if your information is from a website, look at the About Us page on the website to see if you can trust the source. Most importantly, if you're not sure, don't share the information. On the flip side, it is so important to find a few resources that you know are trusted sources of good and updated information, both for you to use and for you to share. This slide shows 3 of our favorite resources for vaccine information. Healthy Children from the American Academy of Pediatrics, Voices for Vaccines, and the Children's Hospital of Philadelphia Vaccine Education Center. HealthyChildren.org is a website created for parents by the American Academy of Pediatrics. It is a fabulous resource, and it's available in English and in Spanish. Voices for Vaccines is a national organization that provides credible vaccine information for families from families. This slide shows their Vax Talk podcast. We both thoroughly enjoy these podcasts and find them very informative. Finally, and we share this far and wide, and we've shared it with you all before, but Children's Hospital of Philadelphia Vaccine Education Center has a mobile app that puts credible, updated vaccine information at your fingertips via your mobile device. Thank you so much. That is the end of our presentation, but we are going to actually start the Q&A with 3 questions that Dorothy's going to pose to me, just because these are 3 things that we wanted to talk about in our talk, but we wanted to make sure we had the most updated information for you. So take it away, Dorothy. Well, thank you, Barb. That was really, really super informative, and I loved hearing about the latest that you know about the vaccines now that our 5 to 11-year-olds can get vaccinated. And I can tell you that pediatricians around the country were ecstatic and rejoicing when the vaccines became available for the 5 to 11-year-olds. We have been waiting, holding our breath for that for that opportunity to come. And so we're excited to share that information with you today and hope that we can answer any questions that you might have. But Barb, I've been hearing a lot about this Omicron variant, and I know you have too, and I'm sure that a lot of our listeners have. Can you tell me what you know about that?
Yeah, it's kind of hit the news big time. We know the Omicron variant was first identified, last week around Thanksgiving is when we were first hearing about it. It's now been identified in 24 countries around the world, and the first US case has been identified as well. It was identified November 29th in San Francisco, California. This variant, we don't know a lot about it, and scientists have lots of questions that they are scrambling to get the answers to, but we know that there are about 50 mutations, separate changes in this virus from the original virus. That's 50 mutations. And about 30 of those mutations are on the spike protein. And the spike protein is what our vaccines target. And that's also, that's what a lot of our treatments sometimes target, like the monoclonal antibodies target as well. And so we don't know what that might mean, but the Delta variant only had 8 mutations from the original coronavirus, COVID-19 virus. So there's reason for concern there. There's reason to think that this is possible, that this variant could be more infectious, so it would spread faster. It's possible that it could cause more severe disease, and it's possible that it could evade some of our treatments or even our vaccines. None of those things are for sure, and we need to collect as much data as we can, as quickly as we can, to try to determine how dangerous this is, or how much of a threat this might be. In the meantime, Dr. Schaffner, William Schaffner at Vanderbilt, and other experts are telling us that the most important thing that we can do right now is to get vaccinated if you're eligible, get children vaccinated who are eligible, and also to get boosters if you're eligible for boosters at this point. And boosters are available for Pfizer and Moderna 6 months after the second dose, and for the J&J vaccine 2 months after that dose. So I loved what Dr. Schaffner said. This was a quote actually in the Tennessean this morning. It's likely that our vaccines are not going to be as effective as they are against Delta or other strains we have in the US. But in any event, hear me now, partial protection is always better than no protection at all.
That sounds like really good advice. So yeah, it is a little bit scary, I guess, but we do have protection that around this variant that we didn't have at the beginning, and we need to take advantage of that for sure. Okay. So I also was wondering, how are we doing here in Tennessee vaccinating our 5 to 11-year-olds? I know we were so excited about getting those vaccines. How are we doing?
Well, thank you for asking. I'm going to tell you, first of all, we know that in Tennessee, we're about at the 50-50 mark for everyone in Tennessee. About half of the people are fully vaccinated right now, which is pretty good. And those numbers, it seems like they change a lot, because sometimes people talk about the percentage of people are vaccinated. They talk about the percentage of people who are eligible to be vaccinated are vaccinated. So we might have heard numbers that were higher than that before, but we're starting now to really look at it as like, okay, we need to know the percent of the whole population that are vaccinated, because all of us are susceptible to COVID. So we really need to know of all of us how many are vaccinated. And right now, as of yesterday, 49.6% of all Tennesseans are fully vaccinated, and 56% have received are at least partially vaccinated or fully vaccinated. So that's pretty good
compared to the rest of the country.
We are like 9th from the bottom, unfortunately. But we are better than 8 other states.
We're working on it.
We're working on it. We are working on it. As for I think you asked about the 5 to 11-year-olds though.
Yes.
And we haven't had this for very long. We've had, these vaccines available not quite a month yet. And the 5 to 11-year-old population in Tennessee is almost 600,000.
That's a lot of kids.
It is a lot of kids, and we want to get them vaccinated as quickly as possible. But right now, about 1.3% are fully vaccinated, which makes sense because you need 2 doses to be fully vaccinated, and they need to be 3 weeks apart. So, but we've got 7.1% at least partially vaccinated. So they've at least had 1 dose. So that's doing pretty well, and it's increasing. But we are hoping to do even better than that. I would say too, I think it's very variable across the state where we are, because there are some counties that we've heard haven't even administered any doses to this age group. And there are other counties that are doing a lot better. And I think that some of our urban areas actually are managing to get these vaccine clinics into the schools, which is tremendous. And I've read about some mobile clinics too, where they're going out and getting kids vaccinated. So we're actually doing probably a little bit better than that statistic in some of our urban areas. And we're doing, unfortunately, probably much worse than that statistic in some areas where there's just some greater hesitancy or more difficulty with access. So
yeah, I think there are more pediatricians and clinics in the urban areas that have the vaccine available, and it's a little bit harder if you have to go to a pharmacy or to the health department to get it. But again, lots of hard work going on to get that done. So we have COVID vaccines available to 5-year-olds and older. Now, is there any indication of when COVID vaccines are going to be available for kiddos less than 5 years of age?
That's a really good question. Pediatricians are waiting with bated breath on this one too, as are parents, because yes, we still have all of these children who are 5 years old and younger, who we do not have a vaccine available for them yet. Pfizer, who is the manufacturer of the vaccine that's available to this 5 to 11-year-old age group, has ongoing studies for younger kids. And we think it's possible there may be something available by the end of 2021 for the older kids in that age group, but most likely we're looking at the beginning of 2022, sometime by spring for sure, to hopefully have something available. But we need to make sure that they're going to even lower doses of vaccine for that group. It's like 1/10, I believe, is what I read for the Pfizer vaccine. And so, we're going back to what is the appropriate vaccine dosing and intervals for those younger, for that younger age group. But we do want to get them vaccinated as well, safely.
But you did mention in your talk, I think, that the flu vaccine is available down to 6 months of age. So we can protect our little ones from flu. And that would be important.
That is correct. And that brings up another really good point, which is the best tools that we have to protect those youngest children who are not eligible to get the vaccine yet are to vaccinate the people around them. And so that means everyone 5 and above who can get the COVID vaccine, if they can be vaccinated, that's going to help. And also, like you said, keeping up with other childhood vaccinations, and particularly the flu vaccine with this winter coming up, because this is flu season, and this is probably COVID season too, because it looks like coronaviruses tend to be a winter virus as well. So we've got a lot of reason to think that our numbers are probably going to go up again with COVID this winter, even if the Omicron variant doesn't turn out to be too bad.
We're kind of already starting to see that. Is that true? That the numbers are going up a little bit?
Yeah, the numbers,
here in Tennessee.
Yes, the case numbers in Tennessee have kind of plateaued, and now they're starting to edge back up. And you know that positivity rate, the percentage of tests that are done that are positive, kind of scientists use that as epidemiologists use that as an indicator to kind of see how much the virus is spreading. And in that number, that percent positivity has gone from 6% up to 9% most recently. And so we're right under that 10% number of test positivity, which is where epidemiologists, scientists get really worried that we've got a significant spread. Also, we've got about 850 Tennesseans hospitalized right now with COVID, and that's a higher number than the hospitalization rate before our last surge, before the Delta surge. And so we think we're going to be started, if we do have another wave, a fifth wave, that looks like we probably will, we just don't know what it's going to look like. We're starting with more people in the hospital already. So the hospitals are really working to try to make sure that they've got as much staff as they can get and have as many beds available to prepare for a potential surge.
I guess staying healthy otherwise, like getting our flu shots and wearing our seat belts. And I have a close friend who's an ER physician up in Western Michigan, and they're having a really hard time now. And in fact, he wrote that it's the worst it's been. And he's been practicing emergency room physician for 30 years. And he said he's never seen anything like this, and he's having to make hard decisions, medical decisions that he never thought he was going to have to make. So we have been doing fairly well here in Tennessee, but it unfortunately isn't over, and we all need to do our part.
Yeah. And, people are just tired of the mitigation measures and, masks and social distancing and all of that. We want to get together for the holidays. And honestly, just the safest way to do that is to be vaccinated and have as many people vaccinated as possible. So yeah, really important. I guess.
Thank you so much.
Those were our questions. Yeah. How about you, Kanika?
Yeah, I had a couple of questions, but someone posted a question in the chat, so I'll let you guys address that one first. Well, first a comment from Jennifer Marchisio. Thank you so much for letting us know that the supply amount and storage is getting better. So her office applied to become a vaccinating clinic. So hopefully other pediatric clinics will be able to apply and do that. So thanks for sharing that information, Jennifer. And then her question is, have you been seeing a lot of hesitancy towards the flu vaccine because of the COVID vaccine? And she says, meaning we have parents that think we're trying to trick them since we offered an incentive for the flu shot, and they think we're trying to sneak in the COVID vaccine. Have you guys been hearing that?
Interesting. That is such a good question. And I think that we see vaccine hesitancy sort of going both ways. We're very worried that just this general milieu of vaccine misinformation, disinformation, fear that we have going on is going to translate or transfer to other vaccines, and that we're going to have an increase in vaccine hesitancy and vaccine refusal for other vaccines. That said, there's also the infodemic includes good information too. People are actually getting more educated about vaccines, and so there's an opportunity here, and it looks like some people are actually saying, well, this vaccine's been around for 50 years, and there's nothing, and it's been doing its job. And they're getting that they're not kind of transferring this fear and resistance to the other vaccines. So it's kind of unclear at this point where we're going to go from here, but it does is always in the back of our minds as pediatricians, trying to make sure that this, whatever's happening with COVID, that we're protecting our other childhood vaccinations. So, and Jennifer, the other point to make is just that that these vaccines have been in really large quantities, like the Pfizer vaccine, you had to get like 1,000 doses at a time in the past, and fairly difficult to store with the super cold storage. And all of those things are also improving. They're starting to package these in smaller units, boxes, I guess, packages, so that you can, so that doctors' offices don't have to have 1,000 patients to give these doses to, and also, and they continue to work on trying to make it easier to store and manage the vaccine. So all of those things are moving in the right direction too. And we've been lucky as pediatricians that these vaccines for kids came a little bit later, as it's getting a little bit easier to manage the vaccine itself in offices. But yes, great questions.
Thanks so much. If anyone else has any questions, we still have 20 minutes left, so there's time to address those. But while we're waiting on others to think of questions, I'll just ask a couple that I had. I think I had heard that vaccinations, or that there were, in terms of immunizations like measles, mumps, rubella, the common ones that were already in existence before the pandemic, that there had been a number of missed doses in 2020. Can you guys speak to that, and whether we're seeing any improvement as it relates to other immunizations?
Thanks. That's a great question too. And that's something that pediatricians are following closely. Worldwide, there have been many missed doses, and particularly of like the MMR vaccines, which measles is very much alive and well and thriving around the world. And so that's a big concern. We have seen catch up. We are doing much better than we were doing at the beginning of the pandemic, when people were really frightened to go into their peds offices. And so we're kids, we were really behind on the childhood immunizations. We're still a little bit behind, but we are seeing catch up. The adolescent vaccines actually are some of the we still see the biggest lag for those adolescents. And so that they are due for a DPT shot going into 7th grade, and meningitis shots. And then also the HPV shot, which isn't required for school entry, but is a super important vaccine to get because it prevents cancer, both oropharyngeal cancers and cervical cancers, 10 or 20 years down the road. And those cancers are surging, not cervical cancer, because we've done quite a good job of getting our young girls vaccinated with HPV, but we are the tonsil and tongue cancers that are associated with the HPV are still increasing, and we're concerned about those kids getting caught up on those vaccines, because if the earlier you vaccinate in that 9 to 11-year-old age bracket for HPV, the more effective those vaccines are at preventing cancer. So, so we are concerned about that and want to see those kids get in. So,
yeah, you mentioned something about required vaccines for school versus something like HPV, which isn't required for school, and that made me think about vaccine mandates and where we might be headed in terms of the COVID vaccine in particular. Are you hearing any discussions or debates about requiring the COVID vaccine as another vaccine in the series that are already required for kids to attend school?
Yeah, I don't. There has been debate, and you know, people. We clearly believe that that's the safest, best way to protect our children in our communities is through vaccination, and so we are 100% behind. You know, vaccinating our children once they're eligible for the vaccines, once the vaccines have been FDA and CDC approved for their age groups. But we also need parents and communities to be ready for vaccine mandates, specifically for school requiremits. And so I think our national partners have looked at that and have come out with some statements, especially Voices or Vaccinate Your Family in particular, right before or right as the vaccines became available for the 5 to 11-year-old age group. They came out with a statement saying, you know, that they weren't going to be recommending school requirements for these vaccines for a while, because we're just not that we don't think that we've got the safety data or, you know, that it isn't the best thing for these kids, but as a whole, you know, as a nation, that we're not, we're just not there yet to a point where that would be feasible or that it wouldn't backfire, people feeling forced to do that. So, yeah,
we're already seeing a little bit of that resistance for the mandates that apply to adults.
Right.
The federal government mandated vaccines for healthcare workers and for anyone who's working at the federal level on a federal contract. And those have been challenged in several courts across the country with mixed results. Some staying those mandates and validating them, or at least pausing them from being implemented, and others upholding them. So definitely can see how that would also apply if that were the case for children. So unfortunately, we're just not there yet to get compliance with that. Another question that I had relates to the Tennessee General Assembly special COVID session that happened earlier this year, and just wondering if there was anything that came out of that you guys are concerned about, or that you'd like to highlight for our audience today.
Yeah, I don't, as it relates to kids, I don't think that anything that relates directly to kids. I don't think that anything that happened in the General Assembly really changed anything drastically from what was happening already. It is frightening, I think. I hate to use the frightening, a bad word. It's concerning that there is this now in statute, in law, this ban of masks in schools, unless there's just this ridiculously high bar that's reached for the community spread that would be happening to trigger the possibility of there being mandating masks in schools. And it's just,
I think that numbers are very low right now, and the spread is, we have things under control right now. So I don't think that it's that worrisome, that we have this ban in place right now. What is more frightening is just if Omicron turns out to be, worse than we hope, or if, something else happens that all of a sudden we are, in a place where we really should be trying to nip another surge in the bud by going back to these mitigation strategies. It's just really unfortunate that we are we've got ourselves put in a corner as far as being able to react quickly and get things under control before it's out of control. So I think it's hopefully that's not going to happen, and hopefully that there would be enough legislators and the governor would be willing to backtrack if we found ourselves in a situation where we needed to change that. And I think that, this just with the vaccines and with the masks and with everything else, it's just these choices that that people are making. There's the risks of the vaccines, the risks of getting the vaccines have to be weighed with the risks of not getting the vaccine and having the disease. And there's really, with masks, there's really no risk. The information out there to suggest that putting a piece of fabric or a piece of, woven paper over your mouth and nose causes anything, but, that you have to smell your own breath, that's all that happens, and it, we didn't see flu last year because it pretty much stopped flu in its tracks because we were wearing masks and socially distancing. And so it's, it's just kind of ridiculous that there's any argument over masks as far as I'm concerned, but.
Hear, hear. I agree. We do have a question about the community toolkit. Is there a link to that you can share? I know we have a copy that we can email to people, but someone's looking for an online.
That is such a good question. And yeah, I have the PDF. You know what? We probably need to send that out with, I'm just not sure I'm going to put my finger on that link immediately. And I'm sorry, but we will definitely, yes, there is a link. There is a link. And in fact, the Surgeon General, they have their own website, like landing page. I can look it up while you guys. Dorothy's going to look that up really quickly because that they have then links to both his advisory and the community toolkit. And I would recommend that people go to that because it's almost a workbook, which is really cool. It gives you some exercises to go through and think about what you might say in a conversation, or, kind of takes you through some exercises for recognizing misinformation when it's misinformation and stuff. So it really is it's a neat toolkit. And it's obviously incredibly timely and put out by great experts. The other thing I loved, when you're, I just thought it was really neat. It is very, they've only used a few colors in it. And they said that the reason they did that is like blue and red and black probably, that it's easy, that it should be fairly cheap to print out and be able to share. And there's some PDFs of one pagers that you can share there. And it's just a really good, it's a really good toolkit. So I hope people will. And do you want to?
I just texted it to your computer. Do you think that?
So we can
I will stop sharing.
Oh, good. Michael, Hook.
Michael,
is that, yes, I think Michael just put it in there. Thank you, Michael.
Yes, thank you so
much.
Yes,
that's perfect. That's it.
I'll also be sure to include the links in the follow-up email to everyone on the webinar, so you can have that in your email inbox for future reference. Let's see, if anybody has any more questions, you still have a few minutes to get them in. In the meantime, I'm going to go ahead and share links to our upcoming webinars. Again, TJC is hosting a webinar about connecting seniors to food assistance programs on December 7th. And we're also having one on December 16th about the Katie Beckett program, which is for children with significant healthcare needs whose parents historically were over income for the Medicaid program, but through the Katie Beckett waiver program, they now can get access to TennCare. So sharing that in the chat. And in the meantime, we got another question. Jennifer says, I know that HPV works better the younger it is perceived, but do you think they will raise the age of recommendations past age 27 due to the increasing numbers of HPV-related cancers?
Well, and as you know, probably Jennifer, they already are recommending it for people at risk who are older in consultation with their physicians. And so I'm sure that they are constantly looking at those numbers and, weighing the risks and benefits of the recommendation. So there's certainly our push is to get our children, get the protection in early when it's most effective and before our kids are exposed, to prevent those cancers, because the vaccines are not as effective when given later. But they're constantly, the CDC and the ACIP are constantly looking at those numbers and determining. I don't know for sure. We certainly are giving it to older, having it open as an option for older people, and I can imagine that if the numbers show that would be wise, that could come along.
Thanks. And then Alan would like to know, have there been reports of significant negative reactions in children to the shot? I assume he's referring to the COVID-19 vaccine.
Yeah, the myocarditis that we talked about that they did see in the older adolescents and younger males primarily, which is mild, and that heart inflammation that either that tends to resolve on its own with maybe ibuprofen or no treatment at all. They didn't see any myocarditis in the studies in kids 5 to 11 getting the vaccine. Now they didn't have enough numbers to that a very rare side effect wouldn't show up. So they said, it's possible that they are going to see some myocarditis when we start vaccinating millions of kids 5 to 11. But two things that are important to note there. The dose of the vaccine for these younger kids is about a third of the dose for older adolescents and and young adults. So that's one reason that they think that it's less likely they're less likely to see that side effect. And myocarditis itself is just not as common in younger kids. So we're there are lots of reasons to kind of think that that's even going to be a less likely side effect. But other than that, no. I mean, they just have not. It's a very, very safe vaccine. And I would add to that, the kids actually, it's more effective in the kids as well. I mean, it's a great vaccine for kids.
I think you mentioned this too, Barb, in your talk, that to point it out again, with adults, we kind of felt like the people that had already had COVID maybe had more side effects from the vaccine, just because your body was kind of already revved up and maybe got revved up even more with the vaccine. But with kids, we are actually seeing the opposite. And that very much surprised me. But kids who have had COVID and then get vaccinated to improve their immunity, they actually have less arm pain, and
fever, chills, those
some of those, those mild side effects.
following vaccine than their counterparts who have not been exposed previously to COVID. So that's a surprise and good news for the parents that are concerned about possibly, getting side effects from the vaccine if their kids have already had COVID. That's good news.
Yeah, that is good news, because I have been hearing that some parents have been delaying or putting off getting their kids vaccinated out of concern about side effects that would keep them out of school, and then the parents would have to take off work, et cetera. So you have this domino effect just from getting the vaccine. So it's good to know that worry is not such a big concern for parents.
And Kanika, I'll tell you one other thing that I think is just important to note is that folks who are really dug in on their thinking about anything, but we're talking about vaccine hesitancy and vaccine refusal right now, that sometimes they need kind of an off-ramp to something's changed. So maybe you should rethink what you're thinking, but it allows them to save face for this decision that they've been making for a year and a half now, or a year since we got the vaccine. And like this new Omicron variant may be one of those times where people can say, okay, maybe that was for you, that was a reasonable choice up until now. But this virus is changing. We know that, Omicron, until we get this virus under control, Omicron is not going to be the last variant that we see. We're quickly getting our way through the Greek alphabet, unfortunately, way too quickly. And the number of mutations on this, 50, that's, it was 8 in the Delta variant. So I think it's also part of talking to people is just kind of letting them know that the landscape is changing. And so it may be a good time to rethink. Again, not with shaming them, not with, just empathizing and listening, but this is a change that maybe we can get a few more people to change their minds. And it's a good reason to get your kids vaccinated as well. So absolutely. That's definitely a silver lining. Although we're living in very uncertain times, there's always time to learn more and change your mind. Amen. Thank you so much. We're all learning more every day. Yes. So yes. Yes. Thank you. So we are at the end of our webinar. Again, everyone, thank you for joining us today. Thank you especially to Dr. Sinard and Dr. Dentz for providing this very helpful information that hopefully you can use to help others in your community make well-informed decisions about their children's health. We will be sharing a copy of the slides as well as the recording of the webinar with everyone who registered, and we'll be sure to include links to the resources that you guys have asked about. If you have any questions, feel free to reach out and respond to the email that you receive, and we'll be in touch. And we hope to see you on our future webinars. Thanks, everybody. Thank you so much. Bye. Bye.